Stop the recording for now. Let's start recording. And all right, so let me turn WhatsApp off, otherwise it's going to drive me crazy. All right, so three strengths and three weaknesses, right? So they could not ask for three strengths, they could ask for one strength, one weakness. Okay, so but generally you should be prepared with three topics to talk about. And there is an concern about what type of answers you should provide. And every year there's a question, so let me just get this out of the way. Especially for weaknesses, you will not mention a weakness that is going to blacklist you or is going to be a red flag. And if you say, okay, so I have trouble memorizing and I'm just not good at things and it takes me a long while to memorize things, or to, I just forget things all the time. So I'm not sure how you're going to turn that into a positive. So that's going to be a problem. So it has to be something that truly is a weakness that somebody can relate to, the interviewer can relate to, anybody can relate to, and will result in, and something that you mention what you did to improve upon that. And that will show that you are self-contemplating and you're able to overcome and identify your weaknesses. Also, because residency is a training program, they don't expect you to know everything, but they expect you to adjust yourself and be adaptable and be open to input and open to change. So this is what I would suggest. And so let's give you a sample answer for your three strengths. All right. Okay. See, gotta prepare. Everyone needs to prepare a little bit. Okay, so all right, so let's do this. So hey, doctor. So have you noticed any weaknesses, or sorry, have you noticed any strengths that you do bring to the table? And we just want to know about that. So you need to know if you're a good fit for the program. Because they're not going to ask it in that manner, but maybe a little nicer. All right. Well, yes, to me, I believe my three strengths over the years, and I've thought about this, my three strengths over the years have been adaptability. And not to toot my own horn, I do believe critical thinking and then teamwork. Let me just get a bit more into detail about all of these facets. So adaptability, I believe, is essential throughout any doctor's life as well as training. And during my rural health clinical rotation, I actually had to adjust very quickly with limited resources and work with an environment where patients had complex conditions but had less access to specialized care. I, being the internal medicine doctor over there, would have to do cardiology, would have to do minor surgical procedures. We only had amoxicillin as the antibiotic. So by adopting to numerous constraints, I learned how to be more resourceful. And I was able to provide effective care to patients despite the challenges. And at the same time, when I needed to, I had to transfer a patient out. Then I would talk about critical thinking. And critical thinking is another strength that has helped me navigate difficult clinical situations. For instance, during my internal medicine ICU rotation, I believe a 62-year-old arrived with fever, confusion, maybe a urinary tract infection, and AKI. And one finding that was a bit atypical, petechiae. Labs also showed falling platelet levels. I had a suspicion. I raised concern for TTP, cytopenic thrombotic purpura. And after discussing with hematology, they did agree. And we did a few more tests, and that's what it showed. So this reinforced that look at things critically, look at all the details. And often you're doing this under pressure. And then in this pressure, you have to make an informed decision in a time-sensitive manner. And that is what healthcare is all about. And I do believe that I have learned to work with this. Then teamwork. Teamwork, I do believe, is one of my core strengths. And in medicine, collaboration is crucial. And I've always, I believe personally, that I've thrived in a multidisciplinary approach. And during my surgical rotations, I did work closely with nurses, anesthesiologists, fellow residents to manage critical patients of all types. And I do believe this is just a regular day for a doctor, especially in the inpatient setting. And by ensuring and be open to open communication and supporting one another, we successfully would stabilize many of patients. And I believe that strong teamwork leads to better patient outcomes and a positive work environment. Thank you. If you have any further questions on this, I'll be happy to help. All right, so this was an answer. So I tried to be not as if I memorized the answer, not as if I, I tried not to be robotic. Okay, I tried. I don't know how it ended up to be for you guys, and give an example. And I laid out. If you were careful, I had a transition. Like I always talk about the transition opening in the beginning, right? So you always need to have some type of a transition. That I did. I think I opened up with. To me, I believe, and I did think about this. That was my transition into this answer. And that led me to be more conversational. I mean, I think I will have to replay the recording, but I thought it was a bit more conversational. So, yeah, then you mention the strength, an example, and how this helps out in the scheme of things. Anybody wants to give it a jab? Anyone?
I can.
Sorry, yes, sure. Please go ahead.
Okay. So I've been thinking about my strengths, and I have quite a few in mind. But for you, I would love to mention some of it here. First of all, I think critical thinking and problem solving is one of my greatest qualities. I've been implementing this as my role as a research associate in one of the Pakistan's largest epidemiological study going on. I have been complimented on it multiple times. One particular example I would love to give here is one time we had falcon tubes where we collect samples. They got stolen, and we have to come up with something that we can that continue our sample collecting process. So we came up with the idea of utilizing serum vials, which do not have any anticoagulant in it. And so we can continue the process. And my supervisors were very happy, and they think it was a very good thing from my side to, just work effectively with limited resources. The other thing I'm really want to tell you about, and I am really proud of, is my sharp memory. I think I have an exceptional memory. I can memorize things in a very short time, and especially numbers. If you give me a number, I can memorize it, and I can tell you a little bit later, and it will be in my head. And I So when I was rotating in a cardiology department in Mount Sinai, they already told me that they love this about me, that I not only know about my patient, but also I know about other patients' information on the team without referring too much to EMR. So I think I will love to display one of this quality wherever I go, because I'm really proud of it. The other thing I want to share is my ability to listen to my patients very thoroughly and very carefully. One example I want to give here is a time when I was rotating in Pennsylvania, and I came across a patient who wasn't talkative, and we expected that he might be mute or something going on. He couldn't talk or something like that. So what I realized is his name is very Indian, and we share similar language. So in my head, I thought like let's try speaking it in Hindi, and I tried to speak with him in Hindi, and he responded. And we were very happy, and we worked through it, and we asked for his wishes, and he wanted to play Kishore Kumar's one of the Indian singers songs. So I request my residents, and he work it through, and he was happy, and we the all team was happy. So that's some of the qualities.
Okay, very good. So instead of me giving some feedback, can someone else give some feedback? Since you've had a couple of these sessions already. It may be of more benefit to you guys if you will not do the same mistake for yourself then. What do you think?
Can I try?
Sure. Feedback or answer?
For feedback.
Okay, sure. Yeah, feedback. Yeah.
Yeah. So, Dr. Adina, your answer was pretty fine and was really good. But I think it could have been better if you could engage your skills as a feedback or as a result. For example, if you mention your communication skills, then it could have been better if you mentioned that communication is essential core of internal medicine residency training or any doctor's life. I think that part was missing.
Okay.
Otherwise, it was perfectly good.
Okay, appreciate it. Yeah, I'll keep that in mind. That's a good point. Thank you.
Thank you.
Anybody else? Okay, so yeah, pretty good. Conversational. Just work on those R's. I think that's it.
Okay.
Okay.
Yeah.
All right. Next, who's next? One thing before I forget, you mentioned falcon tubes. I could not understand what that was.
Yeah. So it's just a tube, but they have a specific name for it. It's called Falcon tubes. It's just like like a big test tube, like something like that.
So you probably have to clarify. You have to come across. Don't say it's a falcon tube. Say a collection tube for sample collection tubes.
Perfect. All
Got
right.
it. So, um,
All right.
all right.
All right.
Okay.
Thank
So then one other thing was I have a few in mind. I don't know. That sounded a little bit. I have too many strong points.
Okay. Okay. Yeah. Strengths, we can come up with a lot of answers, I think, but weakness part is very, very tough.
Right. No, that's fine. But I would just don't say if I have a few.
Yeah, I got your point.
So. Okay. Next. Who's next?
Can I go next?
Sure.
Well, thank you for that question, Dr. Khan. I've been thinking about
one thing. Let's not say thank you for that because they're gonna. I think that's very easy to say, right? But they will be asking you multiple questions. So with all the questions, we should not be saying thank you for that question. So just follow maybe the introductions that I had. I think I basically had said, to me, I believe, and I did think about this. That's enough. That's enough of a transition. Okay. So just think about different transition for each sort of thing. Okay, please go ahead. Sorry to interrupt.
Well, to me, I believe that I'm a good listener. I'm very ambitious and I'm a very fast learner. I'll go over all of these qualities with you. Well, one instance of I feel like being a good listener is a part that is a quality that every good doctor should have because it allows you to actually sit and listen to your patients and cater to their needs instead of just going ahead and implementing the same management plan over all the patients that you have. I once cared for a patient who had diabetes, but he kept coming in with uncontrolled blood sugar levels, and no one could really figure out why, because they kept changing his regimens and everything. So when I saw that patient, I sat with him and I actually asked him what was up, because like all of it, anything that we did never helped him. So after a little bit of probing, he told me that he couldn't buy the medicines because he couldn't afford them. So like it was like a turning moment for me and the team, because I then went ahead and talked to a couple of attendings and came up with a plan that included medicines that he could actually buy, and that ended up in his blood levels being controlled on his next follow-up appointment. So I'm very proud of that, and in my quality of listening to him and everything. Being ambitious, I think it's what drives me every day. I have a to-do list every single day, and I think it allows me to get things done, and it keeps me disciplined and on my feet every single day, and it keeps me motivated to get up every day and help my patients wherever I can and whenever I can. Being a fast learner, I think, is a big part of any resident's life, because when you're in a residency training program, you don't actually have the luxury to sit and absorb everything and give too much time on everything. So I feel like I I have the ability to pick things up very quickly. One instance of this would be my ability to pick up Epic and its workings very quickly in a very limited amount of time that I had in the US. I believe that I've gotten very good at chart reviewing my patients, and I know how to do basic, simple things on Epic. And even though I had a very limited time of access to it, I still picked up a lot of things. So I think that's going to be helping me in my residency training in the future. Thanks.
Okay, very good.
Yeah.
Let me try some other view. Let me try this view. Since there are so many people today. Okay. Ooh, pretty nice, huh? All right, let me actually take a screenshot. Oh, there I do. Okay, so what do you guys think? So I think it was pretty reasonable. The first strength, I think you talked a little bit more about you spent too much time on the patient not taking his medication, unable to afford. You can just condense that a little bit further.
Okay.
One thing is, let me just show you. See how do I look?
I mean, not as clear as you were looking before.
So if you have a light in front of you, you will also look like this.
Yeah, I need to work on my lighting. I will.
Okay, so your audio is reasonable. And just work on the lighting. It has to be in front of you. Okay. So
thank you.
For that's probably for everyone, but you are the darkest. It seems you're looking the. All right. All right. Okay. Who's next?
I can go. It's okay.
Who wants to go?
Yeah, fine.
All right.
Okay. So I've thought a lot about my strengths, and here's what I could come up with. I truly believe that I'm someone who's always curious to learn and willing to change for the better. That is. So, as an example, what I will tell you that we had a patient in the ICU, and we couldn't figure out what was going on with him. He presented with hepatic failure. He was a young patient, 20-year-old. He was just had elevated PT, PTTT, deranged LFTs, and um, when we probed his history, I asked his attendants, all his relatives about his history. We found out that he had congenital splenomegaly. We researched a little bit about it, went on up to date, went on all the libraries. I found out that he had probably had all the signs of, he also had Kaiser Fisher rings that I looked onto. And so I kind of diagnosed Wilson's disease from that. And you know, I looked up everything. I looked up all the tests, and that's how I managed my entire medical internship. At the same time, that whenever a difficult case came, I used to be curious to learn about it, always used to go on up to date, and that's how I think I will be during my internship as well, and I plan to take that skill forward. The second is always being open to learn, willing to change for the better. I was a quite shy person from the start of my med school, and I wanted to change that, and that's why I stood in an election on my for my class. I got to speaking to my peers. I got to speak to a lot of my faculty, and that's how I kind of improved upon this for myself. And that's how I'm able to speak right now so confidently in front of all of you. And that's why I think I will carry this forward in my residency as well. I think the same thing I also carried during my USMLE. I wasn't very good in my studies during my med school, and I did the same thing. I improved myself and improved my medical knowledge to have good scores in USMLE, and I think that's one of the strengths that uh, I definitely will I definitely will bring in my residency. Yeah. So that's it. If you have any questions, please let me know.
All right. So what do you guys think? Okay, so pretty good. I think the first question, the first strength was pretty extended. Could you just
Yeah.
concise that a little bit more further?
Okay.
I like your opener. That was a good transition sentence. All right. So your opener was pretty good. Then you said that you're so confident in front of talking in front of us right now. I would be
I
more.
became because of, sorry.
Yeah. So certainly this has improved my public speaking confidence and my skills. So
Okay.
just say it like that. But otherwise, pretty good. And how's my audio? How's my audio? Is this sounding crisp and clean?
Oh, yours is definitely way better than mine, probably.
So I want you guys to, I mean, I'm noticing your audio is reasonable. On a scale of 1 to 10 is like 4.
Oh, okay.
So, I mean, just watch the recording. I mean, I'm gonna watch. I probably won't get a chance to watch this recording, but watch it again. If mine is a little better, see what you guys can do to improve your audio. Okay, just see for yourself what you guys can do to improve your audio. Audio has to be good. I mean, like we discussed in the first lecture, first session, that you can have an interview without video. Doesn't care if you look pretty or not. Doesn't matter. If your audio is not there, you can always have phone interviews. People have phone interviews. So and on the sound on the phone is pretty clear usually if it's a reasonable connection. So on through these video platforms, you need to have your audio. I think it's important. If somebody has good audio and also a good candidate, because you're competing with hundreds of other candidates, and if that candidate has audio that's much more crisp and clear, they will communicate more effectively. They will just communicate more effectively.
Okay.
All right.
Okay, noted. Thank you for that.
All right.
Thank you for the feedback.
Okay. One last presenter for this question, or if somebody really wants to go. Zarar has his hands up.
Yeah, hi, can you hear me?
Yes, please, go ahead.
Okay, so can I begin?
Sure.
So I've thought about this question quite a bit, and what I came up with are 3 qualities which I feel like suit me the best. The first one is adaptability. And the reason why I see adaptability as the core strength of mine is it's something which I have had instilled in me since my childhood, coming from a family background in the Air Force. We've always had to move every few years internationally, nationally, working in different schools and environments. And then this transition to my professional career, I've worked in rural hospitals, urban hospitals, in outskirts, in a few refugee camps, and each place I've ended up going, I've had to adapt to their challenges, their system of approach, their method of handling patients. And that has taught me to be open minded and flexible in how I approach handling my patients and handling my care. The next quality I see is being a team player. I've always considered myself as an equal member of a multidisciplinary team. And sorry, I'm getting a call. Okay, and a multidisciplinary team. And um, okay, example I can give is that during my time in Shifa, what I arranged with a few of my peers was post the COVID pandemic. A lot of us were the doctors and attendings had a very difficult time coping with the influx of patient load, and it was taking a deep psychological toll on all these patients. So I discussed with my head of department, and we came up with a method, like a wellness method, in which we created a few, let's say, medical camps or events for those attendings and fellows to kind of like de-stress and start enjoying their work again, their peers, their environment again. And that I felt like that willingness to help each other in the group is a core quality which I bring. The last quality I say is openness to learn and willingness to learn. I would describe this as during my time in the US, there have been a lot of cases in which rotating with attendings, there have been a few patients who had complex medical disease, and I would find myself often asking my attendant for an opportunity to read into this case in more detail by myself beforehand to pre-prepare for the rounds, and then so I can bring my own questions and input and be a more, um, let's say, a better dynamic player in the discussions in the rounds. So these are three qualities which I feel like I most bring to the table.
Okay, great. So first off, I think your audio is a little better than the past two people that we discussed with. One thing I do want to mention about is we have to be very clear when we're talking. I think I picked up a couple of words, qualities. To me, the first time I heard it, I had to think about it, what it actually meant. I'm not sure if that everybody thinks the same on this. Then towards the end, you talked about my attendant. You want to say my attending. So, and this happens to all of us because we are not native English speakers. And we need to be able to pronounce it properly, especially now that you are not in person. They can see you through the video, right? They can see you, but that's that's not enough. We have to just make sure that our audio. One thing is our audio that we have on our computers. The other thing is how we're speaking. It's okay. Have a cup of tea or coffee with you. Not coffee is going to make you more jittery. Have something that will moisten up your mouth, and that you're able to speak clearly and openly, and you're able to have expressions. Okay, so if you joined the video from the beginning, I stretched out a little bit, had to open up my mouth so that I can speak clearly, right? So everybody's sleeping. It's a weekend if you're in the US. I actually had so yeah, um, so then you mentioned about Shifa off the back. You mentioned about Shifa. The person in the US who is not a Pakistani person will not know what is Shifa. So you have to just be careful about, you have to qualify that. Don't even mention Shifa. In my internal medicine rotation or in my rotation as a critical care resident or in my final year of medical school during my, right? So they won't know what is Shifa. Again, when you said there has been, I had to think for a second, what did he say? All right, so just work on your speech. Open up your mouth. Everybody practice. Open up your mouth. Hey, I can do it. Why can't you guys do it? What is this? This is nonsense. Stretch it out, okay? So, yeah, and for you as well, your lighting has to be in front of you, right? So look at this. Do I look nice? Right, the lighting, your background is pretty good. You think you have good lighting at the back. I mean, my window is on the side, so it's not, it actually is bright and sunny outside, but it's not, I have the curtain down a little bit, so it's not affecting.
Okay.
So
yeah, I'll work on it.
Right, very good. Otherwise, I think you had the substance down, so that's pretty good. You had the substance down, just have to work on the cosmetic features. It's all about how you present yourself. It's all about how you present yourself. There's no two ways to think about it. Life is all about how you present yourself and how you talk about yourself and how you market yourself. That's it. Wherever you go, you have to market yourself in a way. Okay.
Thank you.
So if anybody wants to go, otherwise we'll move on to the next answer.
Dr.
this is your
Khan, I can
chance so you
try
can pick up
if
your
you want me to.
issues and that you won't repeat the same issues in your actual interview. Rabia, you want to go? Rabia, I see you're here. You want to give it a try?
Sorry, sir, I joined late, so I don't know like what was the question and like how to, yeah.
So if you have it ready, if you have prepared a question, this is your 3 strengths. If you have it ready, you can, I mean, we're just, everybody's making mistakes, so don't worry about it. If you want to give it a try, you can do it. It's perfectly fine. If you don't, that's also fine.
Uh, um,
Your 3 strengths. Hi, Dr. Rabia. So what are your 3 strengths? Can you tell me about what you have experienced for yourself over the years?
um, Sir, I think I have a couple of strengths, but the main strength I think about myself is teamwork. Uh, During my med school, I have worked as a president of my fine arts society. So I have led many like competition of fine arts, and also I have worked as a research uh, team leader. So I have also worked as a team leader there. So I think the leadership quality is the main quality that I think uh, is um, 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 like I can I think this will make me better as a good team leader in the residency too, and in helping other resident and my juniors during the residency. So I think this is the good strength of me. And regarding my other strength, I think the flexibility and to work under pressure, these are main strength, because I have worked in different kind of setting, like in um, rural and in urban settings, and also in tertiary care settings. So in these setting, I have worked as a medical officer, and have done like night shifts and ICU shifts, and like a couple of different settings. So I think I have more command to work under pressure. So these are my main strengths. Sorry, sir, I was not prepared, so I just did.
No, that's fine.
Like,
We're all
what I can
learning,
find.
and
Yeah.
that's
So.
okay. We're all learning, so that's perfectly
Mhm.
okay. I'll just give you some little bit of feedback. And so
Yeah.
again, the pronunciation is very important. When you said medical school, I couldn't, I mean, I could make it out, but just have to be a bit more clear. Just again, practice opening your mouth, and you have to speak English from now on.
Okay.
And you, whether it's your family, your friends, anybody else,
Uh-huh.
you have to get into this, because
Okay.
let me tell you, Indians are much better.
Yeah.
I've said this before. Indians are much better, and they get this edge over us.
Okay.
So it's I don't know, they watch more in movies, I don't know. But Indians are much better. So yes, so you just need to organize this a little bit more. I think
Yeah.
the 3 topics that you hit was reasonable, very reasonable. You have to write this down, and it's okay in these sessions if you want to read off your answer. It's okay to read off your answer during these sessions. This is just to get you ready. This is not to see how bad or good you are. This is for
Okay.
you to get ready and read. You want to read off your notes, perfectly fine. All right, so
Okay.
no big deal about that.
Okay. Okay. Thank you.
All right,
Wonderful.
so I'm gonna move forward with this
Umar,
last question. That is,
Assalamu alaikum, Umar. This is
Dr.
Nagma.
Nagma, what are you doing
Yeah,
here?
yeah, I'm good.
You have an
I
interview to
just
prepare?
no, I just thought I had some time. I just thought I'll pop in, and only listened to last 2 participants, and I do have a little bit of feedback.
Bilkul.
And after that, I'm gonna sign off, of course. So, I mean, first of all, thank you very much for arranging these sessions. And secondly, just to introduce myself, I'm one of the past presidents of our alumni association here. So I felt that all these young doctors, they are doing very well, especially kind of the strengths that they have. But I feel that when they talk to somebody in the interview and telling them about their strengths, they need to be very clear. Number one, like, if you say you have adaptability, then you have to give them a few examples of that, because that would be their next question. So if you give them the examples that I feel that I have this adaptability, and this is number one where I felt like my strength was put into use and it was tested, so then give them some examples. So for each and every strength that you have, you should have something to prove it to them. So that's just I wanted to say. Yeah.
Very good. Yeah, exactly. Exactly. So I can say I'm the best there is, the best there was, and the best there ever will be.
Yeah.
You say, what this guy is doing? He's lying. He didn't give me an example, right?
Yeah.
So doesn't work. Thank you,
Yeah.
Dr. Nagma. Thank you for your words.
Thank you, Umar. Thank you. Yeah.
Thank you, Dr. Agrawal.
Have
Thank
you?
you for your
You're,
feedback.
you're very welcome.
All right, so let's move on to the next question. And I'm going to look to present as usual. Tell me about your 3 weaknesses. Okay. All right, yes, so I do believe that I did think about this. And my 3 weaknesses are, number 1 would be overcommitment. Then I would say perfectionism. And the third that I would like to mention today is asking for help, actually not asking for help. Okay, so I tend to overcommit to projects, which has led to me in the past burnout. And during my outpatient internal medicine rotation, I took on multiple patient cases while actually also volunteering for extra responsibilities, such as helping out with the research project that was being run. While I did enjoy being involved, I realized that spreading myself so thin affected my ability to give 100% to each and everything. And since then, I have learned better to assess my workload and to say no, say the word no whenever necessary. So ensuring that I am fully present for the most important thing in medicine, and that is my patients. Then I mentioned perfectionism. Perfectionism is another challenge that I faced, and I currently do believe I face right now, particularly when it concerns to patient documentation and care planning. And during my, and let me give you an example, because this always used to happen during preparing my discharge summaries. I would often spend too much time ensuring every detail was perfect, while this led to occasionally delaying my other tasks. Since then, I have learned to balance accuracy with efficiency and understanding that while thoroughness is important, perfectionism isn't always achievable in medicine, or not even necessary. You can go over the major points and be concise. Then lastly, I have struggled with asking for help when I am unsure of something. And early on during my internal medicine clerkships, I would hesitate to ask my senior residents or attendings for clarification, thinking it was a sign of weakness. However, I have learned that medicine is a team effort, and seeking guidance when needed is actually essential for growth. Now I feel more comfortable reaching out for help whenever necessary, which has definitely improved both my learning and my patient care. Thank you so much. And any questions about this, please let me know. All right, so this was a sample. So, all right, who wants to go first?
So, I have some different examples in mind. I wanted to run them across you if it's okay.
Sure.
Thank you. So I thank you for the, sorry, let me give up. So that's a difficult question to answer. And I have a few things in my mind, and I really thought about them. But during my applications, one thing that I really felt was my weakness was my research. And though I have been in part of some research, but a lot of my peers are really into meta-analysis and systematic reviews, and I felt like that was lacking for me. So since the submission of my application, what I've been working on is doing learning about how to do meta-analysis, working with some peers, coming up with topics, and hopefully by the time when I join you guys, I will have some meta-analysis published. So that's one thing that I've really been working on. The other thing that I've felt is my weakness. My mom also says it is eating unhealthy food from outside. You can ask my peers a few years ago, I used to be very thin, but now because of this, I've, eating unhealthy, I've gained a little weight and, I've been trying to cut it down and I've realized when you eat unhealthy, you don't feel as good as well. So that's one thing that I've been trying to really work on and really uh, especially when you're in the US and you have a quick life, it's very easy to go into this unhealthy diet. So that's one thing that I've been working on, especially looking at my calories, the quality of food I eat. So yeah, hopefully you'll see a thinner me when I come there. So those are the things I'm currently working on. And if you have any questions about them, please let me know.
Dr. Salman, I appreciate your candidness. You missed, there was one more left. I think we talked about.
I thought of these
Did I
two,
miss
but
it? Maybe I missed it. You talked about two weaknesses.
yeah, I talked about two. Yeah, I didn't think of a third one. Just these two for now.
Okay, all right. So to the interviewer, you will say, I probably have a lot more weaknesses, but I haven't contemplated. But that's okay. But I'll go with these two. That's for now. I mean, just say something. So you have to qualify that you are missing out on one. I'm not sure this will necessarily not happen in an interview setting, but you have to qualify because they will say, okay, you didn't listen to my question, right? So yeah, that's fine. That was good. Your first point that you were lacking in some aspects of research ability, and this is something you felt that you needed to know because this is relatively easier to do. But and you had this in your mind and you want to do it, so that's good. Okay, that's fine. You had some general candid information regarding your dietary habits. It's perfectly okay, reasonable. One more you can think about that is more common. Anything professionally related. See, we all have trouble speaking, right?
Yeah.
Yeah, I think it was okay. I think what I want you to do, I think you are relatively good in your answers. You need to practice in your setup. You need to practice in your interview setup. I think you're always on your phone. So
no, this is the laptop, but I'm currently in a room that's like, like in the US. And I'm not in my official setup right now. I'll be there in 2 weeks. Then I'll probably have a proper setup.
But this is your laptop.
Yes, this is my laptop. This is
okay. Yeah. And you'll be sitting on your bed and doing the interviews.
No, not at all. This is an Airbnb. I'll change the setup after 2 weeks when the interviews come, inshallah.
All right. So next time, try to sit somewhere properly.
Okay. Okay.
So
I will.
Then we can probably give you. I'm trying to give you like feedback about about your setup and everything else. So I'm
I appreciate it. I will.
Right. So okay.
Sorry.
All right. All right. Who's next? Ahmad Sharaz has his hands up.
I've thought about this question for quite a while now, and I think my weaknesses are that I try to be self-critical at times. I used to dwell too much on what I could have done better, even after good outcomes. But I've learned to channel this into reflective practice instead of self-doubt. One example I would like to quote here is that we had a patient while working during my clinical internship in critical care settings. We had a patient in ICU with respiratory failure. That patient later had hospital-acquired pneumonia, and I was too concerned on that patient for myself that I could have done better for that patient. But I believe that weakness has channeled me into a self-reflective kind of a practice, I would say, and has improved me over the period of time. And one other weakness I would like to mention is that I often think myself as a perfectionist, and I demand perfectionism in every aspect of a clinical care or any patient care I do come across. And one of the example I could quote here is that a patient, she has multiple organ failures while working in inpatient settings. That patient had hepatorenal syndrome actually. And while I was caring during my internship, I used to cover all the aspects while being responsible for everything. But later I realized that things could have been better if I could engage more specialities. Things could have been better. Outcomes could have been better if I could have engaged more, for example, nephrology and hepatology and even transplant hepatology. So this is my weakness, I believe. But I've learned over the period of time that teamwork is essential part of medicine wherever you work in your residency, during your internship, or wherever you work. And I have been working on my these two weaknesses. And the last weakness I would like to mention here is that I am quite taken away with the responsibility. I am too hard on myself at times. I'm burdening myself with research work along with my clinical work. So, which I've learned over the period of time to say no to a couple of projects for my betterment. So yeah, these are the three weaknesses I would like to mention. Thank you.
All right, somebody wants to give some feedback. Anyone? Okay, so I think you had the ideas correct. Did you write the question down? Did you prepare your answers by writing them down, or just wondering?
I have written them down, but not all of them,
Okay,
just
how
two of
about,
them.
right, that's fine. I think you should write them down and then practice. Read them, just read them and put them in a word processor and make sure the grammatical issues are hammered out.
Okay.
And when you write them down and read them as you are reading them, you will pick up your own issues. Okay. The other thing was, and this is just feedback. So other thing was, examples were not that precise. So just work on your examples. I'm not sure if anybody else felt the same. They seem to jump a lot within that answer. You would talk about perfectionism, but then you would end up mentioning something else. So that's why I'm saying just write them down. And I'm okay with anyone, if you have written your answers down during this presentation here, during your presentation here, just read it. Just read it on, that's fine. I want you to develop a flow of reading your own. So we all have to work on the flow. So that's fine. So just focus on, write it down, focus on your answer. Don't jump from one and one line. You're jumping, I think you jump from one sentence to another sentence, connecting too many things together. Just be more clear, because then the interviewer will forget about what you talked about in a way.
Okay.
So just be focused, write it down. Make sure you write it down, read it, forget about it, forget about saying it from memory, forget about it. Read it 10 times and then you will be much better at it. Take it. So again, are you on your phone or are you on a laptop?
I'm on my phone.
Okay, that's fine, because vertical is probably not okay. You have to have it. I think usually they prefer Zoom meetings and everything else should be horizontal. So that's fine.
I'll prefer next time. Thank you.
Yeah. And yeah, just work on speaking clearly. That's the same feedback for everyone, probably. Just work on speaking clearly. Have some water or tea next to you. You can sip during your answer. It's perfectly fine. Not a big deal. Just speak clearly. So few grammatical issues that I just picked up. Multiple organ failures. So when you say I think it's multi-organ failure. That's the sort of a medical term, multi-organ failure. I mean, short for multiple. So we don't say multi-organ failures. There's actually a diagnosis code for this also. So just work on it, put it into a word processor, and make sure the grammar is hammered out. Okay.
Okay.
Otherwise, I think your ideas were right. Just have to focus on your answer. Just focus, keep on homing on it. I don't know if anybody else felt the same. But okay, very good. We're all learning, we're all practicing, we're all learning, we're all practicing. Anybody else?
Thank you, Doctor.
Thank you.
Can I go next?
Sure.
Well, to me, my weaknesses are my spoken English, my perfectionism, and my bad sense of direction. I think I struggle with speaking English at times because I haven't really gotten the chance to speak to native English speakers. And that is one hurdle that I sometimes feel that I have when talking to people who speak English as their first language. I'm still working on it, and I have improved a lot on it from where I started, but I still feel like I have got a long way to go, and I hopefully will be much better when I start residency one day. Talking about my perfectionism, I feel like it's more of a double-edged sword. Even though it enables me to get things done perfectly, they also prevent me from doing a lot of things at times. One example of this would be while I was working in my internship back in Pakistan, I had to go ahead and examine all of my patients in the ER. Like I had to do meticulous examinations of all of my patients, even though they didn't require them. And I was only supposed to do focused examinations of all of them. That prevented me from seeing a lot of my patients who actually needed that kind of help. And I'm trying to let go of that habit of mine, but I'm still working on it. Other than that, I'm extremely bad at directions. I still remember how while I was in New York, I kept getting going around one block over and over again, despite the fact that I had Google Maps in my hand. I think in the end, I had to get help from a stranger who like led me back to the Times Square where I was actually trying to get to. And I think I tend to get lost in hospitals as well, and I need to have a better sense of direction to help me in the future. And yeah, that's pretty much it. If you have any questions about my weaknesses, please let me know.
Okay, I think very reasonable. And I think when you talk about a focused physical exam, that is, I would say, is very reasonable because a lot of everyone struggles with it initially.
Mm-hmm.
So that is something good to bring up. So anyone would relate to it. Okay, yes, when I was there 20 years ago, I would, do a whole neuro examination on a patient with heart failure.
Mm-hmm.
So, so, all right, I think it's good. Yeah. Any other feedback for her?
Maybe is that good to mention her language barrier communication?
So yeah, I did feel that your language barrier was not a real weakness. I think your English is relatively okay compared to few other people or more other people. So it's a good point. I did feel that when I was listening to you, I did feel that.
Mm-hmm.
So I would
Is
let
it
you
a
think.
good thing
I
to
would let you
mention?
think about it, whether you think this is something you want to talk about. I don't
Okay.
know. I'm sort of on the fence with this. I think Wundi had a good point.
Mm-hmm.
I mean, it's your communication is the critical and the main point in internal medicine, and maybe mentioning that would seem like a red flag over.
No, my main issue is that she does actually have reasonably good English. So you can, whenever the interviewer will interview, they will see that she does have reasonable English.
Mm-hmm. And they
So
wouldn't see it as a weakness.
they may not see it as a real weakness.
Mm-hmm.
So that's my intuition on that.
No, that makes sense. Thank you. I'll just take that part out.
Okay. All right. All right. Who's next? Ahmad has his hands up. Oh, you've had your hands up from before. Okay. Where's my mouse? Okay, Rabia wants to go.
Okay, thank you, sir. Regarding my weakness, I have three weakness that I want to share. Like, first of all, like I feel I spend too much time with the patient. For example, like during my shift, I used to talk a lot with the patient so that they know well about their treatment and about their condition. And also, I used to draw diagrams and stuff to make them comprehend it completely. So I think it's good for the patient, but now I know that in busy settings, especially in ICU and in emergency setting, this will lead to complications. So I'm learning to balance time management in busy setting. And also, I think the second weakness I can mention here is the attention to detail. Um, I I take a lot of time to on having reviewing on the medication and labs and charts of the patient. So I think at one end it's good because I got small discrepancies in the labs and do not miss anything. But again, in busy setting, it's time consuming. So I'm learning to balance and making the work time effective too. And the third one is I can say over preparing, like for presentation and for the procedure. I spend a lot of time on these things. So I used to come early during my morning shift before the round to have a thorough history and presentation. So I think I need to balance this so that um, I can work smartly on these things. So if you have any question regarding this, kindly let me know.
All right, very good. Anybody has any feedback? Any feedback?
I
I
have
was
one. Okay.
sorry. Go ahead, Edina.
Okay, so I do have one feedback for that. She told us about her weaknesses and she said that she need to work on that, but she didn't say that what did she do to improve that them. So I think she need to add one or two sentences that what she do to improve those weaknesses.
Okay, good point. Zarar has or Salman.
It was really good. The points were really nice. I think I just thought that these were points that were better said in strengths rather. I think for most people. And again, examples could have been more robust, but I think she was very good. The points were can be catered really well. The basic idea was really there.
Okay, all right. So again, one that we mentioned, speaking clearly, that's one I would suggest. I'm just homing in this point because it's very important. And practice speaking English from now on. Don't do anything else. Then you were not reading this from your notes, correct? You were just speaking off the cuff. This is what I understood. Is that correct?
It was some from my notes and some was candid. Like I was just
Right.
thinking the examples and some were like
Right.
from the notes.
I need you to practice each of your answer at least 5 to 10 times. Okay.
Uh,
And
yes.
work on the flow, work on the delivery and flow a bit more. I think that will help out. And
Okay.
put your did you write down your answers on a paper or on a computer?
On a computer.
Okay. Then, for example, you said my 3 weakness initially, so it's 3 weaknesses. So just we all have these grammatical issues.
Yeah.
I'm thinking if you just do 3 weakness, Word will give you an underline that it has to be corrected.
Yeah.
Does it show
Yeah.
it? Does it show it? I don't know. If it's in a sentence, it should show it.
Yeah.
So I don't see your word, but I bet it's giving you an underline. So
Okay, thank you.
so yeah, just make sure, because then from the beginning, this lady messed up with this very, its weaknesses, right? So
Basically, yeah.
basically, right?
Yeah.
So the more we practice, the more we practice, it's only practice, practice, practice. Then there's nothing else to it,
Yeah.
right? It's practice, practice,
Mhm.
practice, practice, practice,
Yeah.
practice.
Okay.
Okay, I think we're over our time today. I'll take one last person, but that's probably it.
I
Or
want to try.
oh, okay, sure.
I'm not sure. I have changed this answer multiple times, so I am willing to change it one more time or a lot of more.
This
I
is your
don't know.
chance to make mistakes. Otherwise, life doesn't give you too many chances.
All right. Okay. So I've been spending a lot of time thinking about my weaknesses. What I have been struggle with in the past few years is my ability to say no to people when I think I should have. So it came from anyone, my mentors, my attendings, my fellows. They can ask me for help, and as I'm a person, I like to help people. So I have a very hard time saying no, but this has caused me a lot in terms of my mental health and my physical health at some points. So I've been working on it quite a bit, and I think I recently realized that this is my limitation, and these are the things that I can do, and these are the things I am not able to manage at this time. For example, I've been faced with the situation when my supervisor asking me to handle two departments at once, and I know for a fact that I was not able to do it. So I raised my concerns and I politely refused the thing because I know that it will affect my mental and my physical health. So I think I have come a long way of dealing with the situation. The other thing I would like to mention is my impatient. I feel impatient when I feel that it's uncertain in an uncertain and unpredictable environment. Um, that has come a lot. If I don't know the outcomes of a possible situation, I might feel some anxiousness or anxiety building up in myself. So what I've been doing with this particular scenario is I try to stay grounded, and I try to focus on more at hand situations and more situations that need my attention at that time. And lastly, I think one of my big weakness is my love for expensive clothing. If I see a good dress, I want to buy it, and I like to see it as like I
I'm
like
not
to.
making the big bucks right now, but I still want to buy things.
Yes, yes, it's costing me a lot of money, but this is I think what I believe is dress to impress. So yeah, if I see a dress, I want to buy it.
How have you overcome this problem of yours?
By working so hard and making money. I
No,
think
but that's
I'm
not really working. Well, yeah, in a way that you can say it in a way that's what you want to do. And this is driving me to become a doctor and make loads of money. Is that
yeah,
it?
yeah, I got it. I got it. Yeah.
Okay. So, all right, I would probably this buying expensive clothes. That's fine. Good to throw in there. And you can say like with everything, you have to be. I'm learning not to go, not to be ruled over by my inclinations,
Yeah, yeah,
especially
I
when my
can.
pocket is
Yeah.
not that big, deep
Mhm,
right now, or whatever.
mhm. What
Okay.
about the other two?
So the first answer, I think, I mean, that's a typical answer, but it was too long. I think just so we a long answer is a good answer if it sounded as you're speaking for the heck of it. That's what it sounded like. It was just too long.
Mm-hmm.
So
Mm-hmm.
concise it a little bit.
Okay.
And the second was pretty good.
Okay.
Second was a pretty good weak point.
All right.
And that was, I think, enough. That was what you needed to do. That was the right duration.
Okay, perfect.
That was the right, and that was composed a bit better. I was
Mhm.
still, for you, I was still work on
Ah,
reading your answer a couple of times. After reading it 10 times, then you close the book and record yourself on Zoom and then watch your recording.
all
How
right.
did you do?
Yeah.
Okay. So
Okay,
work
perfect.
on the delivery. All right.
Yeah.
I think we have a hand raised.
Yes, it's me. I actually wanted to ask you, how can we rephrase or present our 1 year of internship in Pakistan as one of our strengths? Because a lot of us, I'm sure, have that, and it's like it gives us the upper hand over all of the US graduates.
Well, to be honest, generally you're not competing against US graduates.
Mm-hmm.
Generally, the programs that give IMG's interviews are IMG friendly programs. They will have, well, to be honest, they will, okay, you probably are competing with the Caribbean graduates.
Mm-hmm.
You're probably competing with the Caribbean graduates. That's not such a positive. You can say that no, this won't come in the strengths answer. This
Mm-hmm.
will come is that I had a very good internship where we rotated through multiple specialties and I learned these skills, and I
Mm-hmm.
would hit the ground running. You can bring this up in you tell me about yourself or why the specialty, those
Right.
answers. But this will be too common and may sound a little bit arrogant in this question, for this question.
So it's not a strength per se. It's
Not a
just
strength per se, but you should highlight the strength in your other answers, in
Okay.
your why this tell me about yourself and why should we choose you. A lot of people will be saying it, but yeah, that is something that you bring to the table, that yes, I know how to deal with a DKA patient, I know how to intubate a patient, I know how to put in a central line. That so yeah, so you should talk about it.
Okay, thank you.
All right, thank you so much. Until next time. I'm not sure when the next session is, but again, now I think people are getting better. Just practice. And I think, Rabia, you have an interview coming up on the 28th, so I need you to present and be prepared. You're on the spot now.
Yeah,
For the
sure,
next
sure.
sessions.
I'll try this, yeah. for the next
Okay.
session.
All right.
Yeah, yeah.
Sounds good.
Okay, thank you.
Thank you.
Thank you.
Bye.
Thank you everyone for your feedback.